Dr. Connor Armstrong. I'm one of the hip and knee replacement surgeons at South Texas Bone and Joint. So I did a residency in orthopedic surgery, and during residency you go through all the different subspecialties, and I ended up finding a love for adult reconstruction and did a fellowship in Atlanta specifically for hip and knee replacement. So I offer direct anterior hip replacement, which is a more minimally invasive approach where I don't have to go through any muscles or tendons to get inside the hip joint. I think the recovery is faster, people get back on their feet faster. And on the knee side, I offer robotic knee replacements as well as some minimally invasive approaches like the subvastus approach and standard approaches for knee replacement. And I think the robotic aspect of total knee replacement has changed the game and allows you to really fine-tune the position of implants, and I think ultimately that will make outcomes for patients better. I did my medical school at UT Health in San Antonio and was lucky enough to stay at UT Health in San Antonio for residency, and then did a fellowship in adult reconstruction at Emory University in Atlanta. And I would say the most formative part of that training was my time at Emory, where you just become hyper-specialized in specifically hip and knee replacement. I chose South Texas Bone and Joint because of the people in the group. I think all of the partners in the group are great and great mentors. I also really like the subspecialty nature of the group. So we have surgeons that do hand, surgeons that do foot and ankle, surgeons that do sports, surgeons that do spine, and I'll be one of the surgeons doing specifically hip and knee replacement. And I think that subspecialty nature of the group really optimizes care for patients. What patients can expect is a high level of care. I want to spend time with all my patients. I print out their x-rays, I go through their diagnosis. I think I'm a pretty conservative orthopedic surgeon. I don't try and push surgery on anyone. I'll be their doctor from the very beginning to the very end. If they have any issue with their hip or knee replacement, I'll take care of them for as long as I'm around and as long as I'm a doctor in the Coastal Bend area. So one of the reasons I chose hip and knee replacement is seeing the difference it makes in patients' lives. So going from a patient that can barely walk or that's debilitated by pain or confined to a wheelchair and being able to give them a hip or knee replacement, which allows them to get back on their feet and allows them to do the things in life that they want to do, is incredibly rewarding. And I look forward to taking care of the patients of the Coastal Bend and being able to provide that service.